This is Akashvani. In the program Spotlight, now we bring you a discussion on preparedness of public health system in view of rising COVID-19 cases. The participants are Professor Dr. N. Mathur, former Director, Lady Harding Medical College, and Rajesh Lake, anchor.
Emergence of the JN1 subvariant of Omicron, declared as a variant of interest by WHO, is currently in the news, ringing alarm bells in the week before Santa's sleigh jingles its bells. Dr. Mathur, what do you have to say about JN1 subvariant of Omicron? How lethal is it? What are the symptoms? What are the precautions? We'll go one by one. And how worrisome is it for the common man?
So this JN1 subvariant which has come, which is also BA 2.86.1.1, is a variant of BA 2.86, which is an Omicron subvariant. And though it is little different than the last Omicron, which was XBB family, it is another sublineage of that, and it is a variant of interest declared by WHO. It is little mild so far as we know till now. It has behaved in a very mild flu-like symptoms, influenza-like symptoms, in which there is an upper respiratory tract infection in the form of running nose or blocked nose or little fever, lethargy, malaise, and but there had not been much incidence of pneumonia like which was there in other variants of COVID. And the effect on the lungs per se is not that much as it is in the upper respiratory tract. And it is like a mild influenza-like symptoms as far as we know till now. Though there had been few deaths reported in some parts of the country, but those deaths were not very much established because of the effect of COVID, but it was more because of the comorbidities with which these people suffered.
So, Dr. Mathur, in reality, correct me if I'm wrong, the COVID virus never goes away. It never will, in fact. It is now a part of our ecosystem with ongoing mutations and periodic phases of rise and fall as new variants come and go and seasonal changes enable or impede a rapid spread of respiratory viruses. Am I right?
Yes, you very rightly said that Omicron virus will not go away. It is like any other virus. It is going to stay with us, and we have to live with these viruses. And only thing is that these viruses keep changing their genome sequencing, and so their effect on the body of human beings keep changing. Sometimes they will be mild. Sometimes it can be possible. It is possible that they can be little dangerous. But usually, what has happened is they are going milder in a milder form and changing towards a mild disease. But they will always be there, and we have to be very vigilant and keep on taking the samples whenever there is an upsurge of these diseases, so that we have the genome sequencing and we have a good data available as to how the disease is progressing in the environment.
So, Dr. Mathur, the threat a variant poses to the population as a whole, and specifically to the vulnerable persons within the community, all depends on the acquired virus or vaccine-induced immunity in the people and level of the variant's virulence. In such a scenario, you think there is a case for another vaccine dose to be given to the population?
The decision of it will be taken by health authorities, but we know this much that the vaccines which were there is effective against JN1 also. So the people who are vaccinated have been immunized for JN1, which is prevalent these days. So there is no need for a separate vaccine as such, but all the vaccines will be effective against JN1 as per WHO also. But whether another vaccine booster dose is required or not, that decision will be taken later.
And what about the way the virus mutates and all that to a common man? If there is a virus, then that virus be scientifically be done away with. How does it mutate? What happens? Where does the mistake takes place that the virus starts or continues to mutate? Or as we said earlier, the virus will never go away.
So it is something like, Darwin's theory, the survival of the fittest, and they keep changing. The virus will keep changing its form so as to propagate and remain in the system. Like we as human beings also do our best to survive. So does the virus. It does its best to survive in the system and propagate and remain, there in the system. So for that, it needs to change its form, and the form that it changes, how it has changed the form or it has not changed the form, we as a scientist come to know by doing the genome sequencing. And we just keep doing genome sequencing and that's how we come to know that the virus has really changed its form or not. Otherwise, just by looking at it under the microscope, we may not be able to, electron microscope, we will not be able to find out whether the virus has changed, but unless we do the genome sequencing. So we keep doing the genome sequencing and to know whether the virus has really changed or not. But it keeps changing, and that is how it survives.
I understand that as immunity levels build up in the population and seasons change, respiratory viruses recede but do not fully disappear. And also their genes remain in circulation at a low level or can be reactivated within the human bodies which they have infected earlier. And it is so heartening to hear from you that new vaccine is not required. The current vaccines that are there are good to counter the virus, and whether we can have the booster dose or not, the government will decide and let us know. A common man, what should he do if he gets a cold? Should he panic or just take it as naturally as it comes to him? What are the precautions a person can take? When should the alarm bell ring for us?
So the precautions are just the same as it used to be before. That is wearing the mask, maintaining social distance, 2 arms the length of distance, and not going in the crowded place. So those things remain the same. But the symptoms are very mild, and they are just like influenza-like symptoms if it happens. And it's a mild form of influenza-like symptoms, and in which there is upper respiratory tract infection and a fever, mild fever, and malaise. And but what the person has to do whenever these symptoms are there is to get an RT-PCR done. It is beneficial in 2 ways. One, that he will come to know whether she is suffering from any COVID-like illness or COVID disease. And secondly, it will also give us the sample and which the samples at random are taken and sent to a lab of INSACOG laboratories, which are NIV Pune and NCDC, to do the genome sequencing. As scientists, we come to know whether genome sequence is changing or not, and time to time, we also these laboratories also tell to the WHO about it.
The JN1 is a sub-lineage of BA286, as you mentioned, or Pyrola, a subvariant of Omicron.
Right.
It was first detected in Luxembourg, I was reading Dr. Mathur, in August this year, and subsequently it has been reported by England, Iceland, France, and US, all countries where genomic surveillance is active. Now, people say that when it is cold, the virus does not come up. I mean, these are all rumors we're talking about. I just wanted to check with you. How true is it? Does it come up in extreme heat situations or when it is very cold? Is there any correlation?
There is no direct correlation. As far as we know, there had been when the disease started, we were thinking that during the summer seasons, the virus will not survive. But we know very well that in the Delta disease that we had, the maximum incidences were in the month of May 2021. So, or even in the winters, because of the close proximity of the people hugging together and remaining in the closed space, eating together, And, in small spaces, the chances of infections are rather more and the propagation is more. So winters or summers do not actually have got much role to play as far as the disease is concerned.
And also based on current evidence, JN1 appears to be more ineffective and possibly more immune evasive than pyrola, but not any more virulent. Am I right? Because there is a case in Kerala, India's first case. The woman was 79-year-old and she experienced only a mild illness.
That's absolutely right. And the disease so far, as we know, in about 300 odd cases, had been very mild in India. And the people who have died, about 5 deaths have been reported, are because of the people who were otherwise having comorbidities with them. And the virus was not that much virulent in itself. So that is how the situation is as of today.
So don't you think we have a case for a booster dose to be given to people, as the behavior of this variant will be better identified as we ramp up genomic analysis? And JN1 has emerged at a time when antibody levels in previously immunized or infected persons would have faded. So isn't booster dose, you as a scientist, be an advocate for a booster dose?
Logically speaking, if the answer would be yes, logically speaking, and the answer would be emergent if the disease that it was causing was little serious one. But yes, some booster down the line would be required, and I presume that it would be some, like you have flu vaccine given every year, the situation would become like that only for the Omicron also, or for the COVID. That one vaccine would be required, once a year or once in 2 years. That could be the possibility going ahead.
So what do you have to say about, as both have discussed, that there are very mild symptoms or the illness? It may require people to stay away from work or classes. That's a question that I have for you. Or can we get along with our lives as we move to 2024 with sensible precautions, even as the novel virus that emerged in December 2019 enters a new sign of its own? What's your take?
I would presume that especially for a month or so, when the disease is evolving, because we never know how the disease evolves. Sometimes it evolves very fast, as we have seen in the past. And so it would be worthwhile, and being the holiday season coming up, I would suggest that the social distancing, wearing the mask and maintaining some distance should be adhered to for at least a coming month.
Thank you so much, Dr. Mathur, for throwing light on the JN1 subvariant and what precautions and symptoms there are, and how people need to be careful by following the precautions that you mentioned during the discussion. Thank you so much for being with Akashvani.
Thank you very much.
You were listening to a discussion on preparedness of public health system in view of rising COVID-19 cases. The participants are Professor Dr. N.N. Mathur, former Director, Lady Hardinge Medical College, and Rajesh Lake, anchor. This program was produced and presented by the News Services Division of Akashvani. You can listen to it on our mobile app News on AIR. This program is also available on our YouTube channel, News on AIR Official. You may share your feedback about this program through email at airnsttalks@gmail.com or WhatsApp on 928-909-4044.